it's not too difficult for the arms and the legs. All right, it's pretty straightforward. There's a couple things to point out. It doesn't go into all the detail that we would like, but so be it. All right. So, unfortunately, as you can see, this is the opposite leg to the picture that's up there. All right. I don't know if maybe the other one actually is, but I don't think it has as much detail. But here we are starting at the top. We ended inside the trunk with the common iliac, the internal and external iliac. This also starts at the common iliac, and it also starts here at the common iliac. And then as you come down, you can see it's going to bifurcate. And one large vessel is going to leave, okay, and come out to the leg, and the other one's going to stay inside. This is the pelvis here, right? Here's the pubic symphysis. We're inside the pelvic bone. Internal iliac, external iliac, and it's going to come under this white thing is the ilioinguinal ligament, and here it is exiting onto the leg. And as you can see there, all right, when it exits, and I'm looking for the label, it's all the way down, unfortunately, but it becomes the femoral. So here it's the external iliac. When it passes this white line, the ilioinguinal ligament, it becomes the femoral. All right, and the femoral on this model pretty much gets to about here, and then it's diving inside the. Well, I guess it's diving in somewhere over here. I can see a little bit of it continuing down. That's where the glasses come out. Okay. So here it is, the femoral coming down, and it's tucking in to the muscle. And while we're at it, I mean, you have running side by side with it the vein, and there's not too many veins you're going to find on the arms and leg models, and that's one of them. That's it. And I don't even know if there's any here. Yeah, and there's one here. Okay, it's the continuation of the femoral. The femoral starts here. It tucks into the muscle there, and then it comes back out here. So you have the femoral artery and the purple thing next to it, the femoral vein. So here you see it. When it passes under the ilioinguinal ligament, it becomes the femoral, and then it goes all the way, basically just almost to the knee, just above the knee, and then it's going to start to branch and change its name. All right, so that's pretty straightforward. So let's follow it down. Let's go to the next picture. All right, so here we are. We're ending here at the femoral, right about here, at the femoral. It's going to pass behind the knee joint. So about from here to here, when it's behind the knee joint, it's called the popliteal. The popliteal. Same vessel. It's called the popliteal. All right? And that goes to about here. All right? And then what you're going to see, yes, there's a couple of little branches coming off the side here, but there's going to be 1, 2 branches coming off to the left, and then it continues down the back of the leg. So here we are. We're right about here. We've come off of the femoral, down the popliteal, and the branches that we're talking about are these 3 guys here. Anterior tibial, posterior tibial, and the fibula. All right? Now, the easiest one is the posterior tibial. Posterior tibial is the one that just continues down. It's the femoral to the popliteal to the posterior tibial. It goes behind the tibia. That's the one running right down here all the way to the ankle. The other 2 are going to branch off of that, and one's going to become anterior tibial in the front, and one's going to become fibula. So let's follow the branch. This top branch here is coming here, and then it's coming through, and it's popping out right here in this gully, running along the front of the tibia. Hence the term anterior tibial. All right? This one, you see the branch coming off, and it's running along the fibula. I mean, here it is. It ends here, and then it goes under the muscle running along the fibula. Don't even see it here in the front. It pops out again down here, but it's running along the fibula inside here. That's the fibula branch. Fibula artery, branch of the fibular artery. Right? So we have common iliac, external iliac, internal iliac. It becomes the femoral when it crosses here, femoral artery and vein. It tucks in, comes out here, femoral artery and vein. About here becomes the popliteal. And then when you get to the first branch tucks in and comes out along the front of the tibia. That's the anterior tibial. Here's the fibula, and this continues down the back of the leg, posterior tibial. Right, that's kind of the main thoroughfare down to the foot. Now, when you get down to the foot, all right, there's the posterior tibial. That's this one back here. It makes a loop. Okay, it makes a loop, a deep loop. And off of that loop comes the digital arteries, the arteries that supply the digits. And can you see any digital arteries on here? Yeah, you can see one. One, between the first and second toe, there's a little red vein, one of the digital arteries. It's coming off of one of the loops. There's two loops in here. Right, the artery comes down and makes a loop, and the digitals come off of it. There's a deep loop along the bottom of the foot, the plantar arch, and there's a superficial loop, the dorsal arch. You can see the two of them superimposed over one another. Okay? Two loops. And off of them come the digital. All right, notice that the posterior tibial creates one loop, and the anterior tibial creates the other loop. You can see a little tiny piece, I'm talking about little, tiny piece of the dorsal arch. It's right in between, again, in between the first and second digit. There's a little piece of artery going like that. It's part of that arch. Part of that arch. Now, just to point out, see the dorsalis pedis? That little vessel there, somewhere about right here. We can, make one up if we want to, but we won't. That's a pulse point. You can feel the heart contraction, the pulse, here at the dorsalis pedis. And it's one of the pulse points that you do when you're doing an examination of the circulatory system. Right? You're checking here on both feet, and you should feel a nice strong pulse. It's indicating that there's good flow through the femoral and all of its pathways. Because this is an area where you can get atherosclerosis. Right? And you obviously check pulse points in the arms. There's one here. There's one here. Okay?